I'm Neblett, 4 Points Family Chiropractic here. I want to welcome you today to our Living to 100 webinar series. Today, we're going to be talking about low back conditions. I want to make this a little bigger there we go, so I can see what I'm doing there. We're going to be talking about low back conditions. Low back pain is 80% of Americans are going to experience some serious bout of low back pain in their lives. 50% of Americans report they have at least one episode a year of serious low back pain. It's the number one cause of disability in the world today. So not surprisingly, it's also the number one reason why people reach out for chiropractic care. On a personal note, low back pain is the reason I reached out to chiropractic in the beginning. I injured a disc in my low back and was facing surgery. I saw a chiropractor. He was able to help me walk through that process and avoid surgery. It's the reason I decided to become a chiropractor. So this is a very important topic for me. So we are going to talk about low back pain today, its common causes, how you can prevent it, and what to do if you've got it. All right. And what we're going to do is for any of you that want to get your spine checked out, maybe you've had low back pain episodes or want to prevent it, we're going to have a very special offer in order to allow you to come in and get checked out. We'll talk about that a little bit later. But before I get into all that, I want to talk about our office. 4 Points Family Chiropractic. We're located in Northwest Austin. We serve the communities of River Place, Steiner Ranch, Grandview Hills, Canyon Creek, Hudson Bend, Jester Estates. But we actually have patients that drive from all over Austin to see us and come from as far away as San Antonio, Houston, and even Dallas because of the results we get. So we have a very broad reach. So having said that, let's talk about types of low back pain. All right, there's two basic types of low back pain. There's acute pain and there's chronic pain. So acute conditions are conditions that are relatively new. We're talking days or weeks. They tend to come on quickly. They tend to be short in duration, at least as far as the pain part goes. And they usually are tied into some type of injury. Chronic conditions, on the other hand, are more long-term problems. So think months or years. They may not be there continuously. They may show up as regular episodes that show up on an ongoing basis. But think about chronic conditions. They tend to be progressive and degenerative in nature. So these episodes tend to occur more frequently over time and become more serious because the condition gets worse if it's not taken care of. Does that make sense? So let's talk about acute conditions. Two of the most common causes of acute low back pain are sprain strain injuries. All right. Sprains and strains are first cousins to each other. They both involve damage to tissues. So with a sprain injury, we're talking ligaments. Ligaments are the tissues that protect joints and hold the bones and joints together. When we talk about strains, we're talking about muscles and the tendons that connect muscles to the bones. So they're very similar to one another, and their causes tend to be similar. Typically, the way that we create sprains and strains are by some type of lifting injury. Either we lift something that's too heavy or we're in an awkward position when we lift. That can be caused by sports injuries, sudden movements, traumas. And I'll tell you, this time of year, we see lots of patients in our office who are suffering from sprain strain injuries. Because what do? This time of the year is when we get back out in the yard. We start doing yard work again. We drag heavy bags of mulch around. We bend over our flower gardens and pull weeds. Using muscles we haven't used for several months. This is also the time of year where we tend to get out and get into sports activities and the outdoors. And again, maybe we're swinging a golf club for the first time in a few months. These are the kind of things that can cause sprain strain injuries to occur. Now, sprains and strains can range from fairly minor injuries to injuries that require surgery. So important that we keep an eye on that. If they aren't managed properly, they have the potential to become chronic and progressively more serious injuries. So it's important to deal with these injuries when they occur. And these are the kind of injuries that a lot of times people don't take care of when they occur. So we see a lot of this in our office. Another type of acute condition I want to talk about are injuries to our discs, the discs that we have in our spines. So I'm going to go into more detail about disc injuries in a moment. But the reason I want to mention disc injuries here is the cause of disc injuries is very similar to the cause of sprain strains. They typically come from heavy lifting in awkward positions, trying to drag bags of mulch around the backyard, bending over to pull weeds out of our garden, doing spring cleaning in the house, getting underneath awkward positions and trying to pull things out from under. This is the way we see people develop disc injuries, sports injuries. Um, and it's important to know which tissue has been damaged. So that's why I wanted to bring in here, because of the similarity with the sprain strains. Very important to get these injuries checked out and to deal with these at early on so they don't become bigger, more chronic problems down the road. So what we want to offer, before I go there, a common consequence of these acute injuries is a condition called a subluxation. What a subluxation is, it's where the vertebrae become misaligned. And when that happens, it puts an endangering stress on the spinal cord and the nerve root where it exits the spinal cord. And this can cause all kinds of different types of health consequences that can range from back pain all the way up to advanced degenerative changes and disability. Those are commonly caused by these types of injuries, or there could be an existing subluxation that got aggravated as a result. It's the number one condition that we see in our office when people come to see us. Kind of like going to the dentist and getting your teeth checked for cavities so that you can correct those early on. Subluxations are very, very similar. If we catch those early and correct them, they don't cause the kind of problems like degenerative joint disease that we see happen if they're not corrected. So if you're experiencing any of the kind of acute symptoms that I was talking about earlier, we want to help. So what we want to offer you is, if you'll call our office, 512-345-9355, and mention this webinar, we're going to offer you an initial comprehensive spinal examination that'll include orthopedic exams, neurologic exams, a biostructural exam, a thermographic nerve study, any necessary x-rays. And we're going to follow that up with a special one-on-one appointment with one of our doctors. We'll review our findings with you. And if we do find a problem, then we'll discuss that with you and talk about what we might need to do to help you keep that from becoming a bigger problem. All right. The other thing we're going to do is at that first appointment, we're going to give you as a special gift a chiropractic memory foam cervical pillow that we sell in our office for $50. These pillows will help you prevent developing cervical problems like text neck. We're going to throw that in as a special gift to you for taking action. So call our office, 512-345-9355. Mention this webinar, or you can go to our website, fourpointschiropractic.com, and we have the ability for you to schedule an appointment there as well. So if you'd like to take advantage of that, give us a call. Now, another type of pain that we see in our office are chronic pain conditions. So chronic conditions, as I mentioned before, are either long-term pain, we're talking about months or years, or episodes of low back pain that repeat themselves for long periods of time. As I mentioned before, these tend to be progressive and degenerative in nature, meaning they get worse over time. So if you start this pain repetitive episode cycle, you're going to notice that over time, the episodes do get worse. So frequently, these conditions result from acute conditions that weren't handled, like sprain strains, subluxations, and disc injuries. And what happens is it causes the accelerated deterioration of spinal joints and discs and the formation of scar tissue and adhesions in spinal muscles and joints. That's what causes this disability to progress over time. So this results in pain and inflammation, and it's a very common reason people come to see us. Frequently, we'll see chronic conditions that we could have prevented from getting there had we been able to take care of these earlier on. We're happy to have the opportunity to help, but again, that's why we stress the importance of getting these things checked as soon as possible. Now, these degenerative conditions that I talked about can result in degenerative joint disease. One of the problems that can happen with advanced degenerative joint disease is a condition called spinal stenosis. If you've ever known anybody with spinal stenosis, it can be heartbreaking, because what happens is as those joints degenerate, we get to the point where the holes where the spinal cord and nerves come out shrink from the bony changes that happen in the spine, and they get to the point where there's no room for that nerve anymore. That chokes the nerve out. Patients that develop stenosis, as you know if you've known anybody, they have debilitating pain. Usually results in disability, numbness, loss of function, muscular atrophy, pretty significant problems, and can get to the point the only solution is to either have those joints fused or long-term pain management with pain meds. So we want to help keep these things from getting here. Like certain types of cancer, stenosis is absolutely preventable if you handle it early on. So early detection and early correction is key to avoiding long-term degenerative problems from developing at this point. Now, I mentioned previously disc problems, so I want to talk about disc conditions today. These discs in our spine, they act as shock absorbers. They're also space holders for the nerves where they exit the spine. So they have important functions. Now, if I was to lift the vertebra off and look down on the disc looks like a jelly donut. The middle of the disc is an encapsulated encapsulated gel, like a ball of goo. And then around that ball of gel, there are rings of fibrous cartilage. Those are called the annular rings. The middle of the disc is called the nucleus. What happens, those discs are highly innervated. There's a lot of nerves in there, which makes them significant pain generators when you damage a disc. Discs are a very common reason people come in to see us. One of the common things we'll see, the outer rings of the disc can get torn. That happens from some of the things we mentioned earlier, bending, lifting, twisting movements, particularly when you're lifting something. Very common way to damage a disc. We can do it in sports injuries. Car accidents can cause that. But when those angular rings are torn because of all the nerves, the disc becomes painful and inflamed. It can be severe pain, and it's a common reason people come to see us. What we tend to see in somebody that comes in with torn disc fibers is when they try to transition from sitting to standing, it's extremely painful. So patients will come in and complain that about halfway up they get stuck and can't go the rest of the way. So if you're dealing with that, or somebody you know is, there's probably been injury to some of those disc fibers. Now, those tears tend to heal in time with scar tissue. Okay, that's the normal healing process if you take care of them. Uh, Good and bad with that. So there's a healing that's happened, but scar tissue is not as strong as the original tissue is. It weakens the disc, and it's also more pain sensitive. So it sort of sets you up for more back problems down the road, and it also sets you up for that disc to degenerate, particularly if you don't take care of that going forward. So it's important to do that. Now, if those tears extend all the way from the middle, the nucleus, out to the edge of the disc, what can happen is that gel in the middle can get squished out and cause what's called a disc herniation. So a disc herniation is a more serious disc injury. Here, now you've got potentially the disc pressing out on one of the exiting nerves or spinal cord. And depending on where that is, it can range from severe pain that you have in that area to radiating symptoms into the legs called sciatica. That could be pain, numbness, things like that. Again, this is very important that it be managed. Disc herniations can be, I started out my first chiropractic experience, I had a disc herniation. I had a chiropractor help me manage that herniation and avoid surgery. If it goes too far, surgery becomes the final solution to that to get the pressure off the nerves. So again, early detection, early correction is key to keeping this from becoming a bigger problem. Another type of disc injury is called a disc bulge. A disc herniation is a more focal type of injury. A disc bulge is a more generalized injury where we see the disc actually bulging out along the whole circumference of the disc. This usually comes from a weakened disc from previous tears. It can come from a degenerating disc. Sometimes there is no pain with a disc bulge, but typically we will see pain. And again, one of the consequences of disc bulge is it speeds up the degenerative process of those joints. All these things, all right, are preventable. All these things can be managed if they're caught early enough. So I want to stress one more time the importance of getting these things checked out as early as possible. Both bulges and herniations accelerate disc degeneration and can lead to degenerative disc disease and osteoarthritis over time, again, if they're not corrected. So if you're dealing with any of these types of symptoms or have a loved one who is, we want to help. If you'll call our office, 512-345-9355. Mention this webinar. We're offering that initial comprehensive spinal examination with orthopedic exams, neurologic exams, a thermogenic nerve study, biostructural examination, x-rays, follow-up appointment with a doctor to go over what we found, help distinguish how serious your injury may be and what kind of intervention it requires to keep you from developing bigger problems down the road. We'll do all that for $67. Outside of this webinar, we charge $270 for those services, but mention this webinar, we'll do it for $67. We'll also throw in that cervical pillow I mentioned earlier. We sell for $50 at no additional price. So again, we want to help you. If you're dealing with any of these things, please call. Don't put it off. It can become a bigger problem down the road. The last condition I want to talk with you about, sciatica. I alluded to that earlier. Sciatica occurs when there's radiating pain or numbness into the legs, feet, or toes. It can show up in one leg or both, depending on where the problem's created. The sciatic nerve is the largest nerve in the body, and it stems from nerves that originate down here in the low part of the back. So sciatica can be caused by different things. It can be caused by a disc herniation, like I mentioned earlier. It can be caused by stenosis or degenerative joint disease. It can be caused by a subluxation, pinching on one of the branches of the sciatic nerve. Any of those things can cause sciatica. The severity of the sciatica, it isn't the amount of pain you have, it's which one of those conditions is causing the sciatica. That's why it's important to get this checked out. If we can determine what the cause of the sciatica is, then we can help you decide on the best course of action to make sure this doesn't become a bigger problem down the road and then could lead to something that's debilitating. So again, we want to help. So before I get into talking about the offer one more time, I want to talk about how to prevent these things from occurring. The best way to prevent these things is by exercising caution when you find yourself about to put yourself into a compromising position. So how do these things happen? They happen when we try to lift things that are too heavy. So ask for help. Use your knees. Be careful when you're lifting heavy objects, particularly this first time out there. Try to avoid bending, lifting, and twisting. That's a very common way of damaging those joints. When are people injuring themselves? They're injuring themselves when they get out in the yard. So watch yourself when you're dragging heavy bags of mulch. If you find yourself bending across the flower garden to pull weeds, that's a common way to injure discs. If you're in the house doing spring cleaning in an awkward position, that's another way people injure themselves. I had a patient once. She was underneath a computer desk, unplugging the computer from the wall, and just that action of unplugging caused her to herniate a disc. So be careful if you know you're in an awkward position. Be careful when you're lifting things. Use those legs. That's probably the number one to prevent yourself from injuring your low back. The second thing is to focus on keeping your core muscles strong. The core muscles in the abdomen and lumbar spine support the spine. All right, they help prevent injuries. They give you a foundation so that they absorb a lot of the force that would go into the spine otherwise. In order to help you strengthen your core muscles, we have a couple of resources for you on our website. If you go to fourpointschiropractic.com, on the right top part of the screen, you'll see a More tab with 3 dots by it. If you click on the More tab, the bottom item that drops down is rehabilitation and exercise tutorials. We've put a number of different tutorials on there for you, but some of them are around core stability. We have 3 different levels of core stability exercises that Dr. Mary and Jordan put together. So I want to encourage you, go there, utilize that information, start the process of strengthening your core. Plus, last month, Dr. Mary and Dr. Haley did a special webinar on postural exercises and core strengthening exercises, and they demonstrated some exercises in that particular webinar. We have that on our website under Watch a Workshop. One of the exercises they demonstrated was called the dead bug exercise. That's specifically for strengthening core muscles in your low back. Check that one out. It's about a 15 to 16 minute long webinar, and there's some very good tips in there on how to strengthen your core. So again, we want to be a resource for you. We have other resources on our website. Those are just a couple I'll mention right now. The other way you can do this is if you're one of our patients, next time you're in, talk to us about it, and we can tailor an exercise program specific to your condition to make sure that you get the most benefit from what we give you to do. All right? So as I mentioned before, chiropractic is very beneficial in treating every one of the conditions I mentioned today. We see these conditions on a regular basis in our office. We've helped literally thousands of patients experience better quality of life through the treatment plans that we set up for them. Probably something we like even more, we have a lot of patients who come in not to treat low back pain, but to help us set up programs so that they prevent them or maintain their spines in their optimal health. Either way, we love to help patients set things up so we can help you be as healthy as possible. So, as I mentioned, their low back injuries are very common. Sometimes we can do all the right things and still injure our backs. So if you're in that position, or if you know somebody that's in that position, either you've had an injury, you're concerned about a previous injury, you're in the middle of an episode, you've got a chronic episode that's been going on for a long time, or you want to make sure you don't develop any of these things, if you'll call our office, we'll offer that same special exam that I mentioned before, a comprehensive spinal examination, including x-rays. We'll do that, normally priced at $270 for just $67 if you mention the webinar today. We're going to throw in with that at your first appointment. We'll include a chiropractic memory foam cervical pillow at no additional charge. That's as a special gift to us. to reward you for taking action, to be preemptive, to make sure that you keep yourself as healthy as possible. All right. So I want to thank you for attending our Living to 100 webinar on low back pain today. Next month, we're real excited. We're going to have a special webinar on headaches. Dr. Mary and Dr. Haley are going to work together on that as well. So if you know somebody dealing with headaches, migraines, anything like that, tune in. We're going to have some great information for you there, some ways to prevent and treat headaches. Watch out for our notifications. We'll be sending those out, letting you know when that's going to occur. Again, I'm Dr. Tom Neblett with 4 Points Family Chiropractic. On behalf of Dr. Ross Cucciamillo, Dr. Cucciamillo, Dr. Mary Elder, and Dr. Haley McHugh, and as well as our staff. We want to thank you for attending today, and come see us. We want to show you a better way to better health.